Welcome to Washington in Focus. I'm your host, TJ Martinell. With me is Carlene Johnson. So the state legislature has passed price controls on the medical industry in the hope to keep costs down. But the industry leaders are saying the exact opposite effect is occurring. Carlene, what's going on?
Yeah, there was a meeting on June 3rd of what's called the Healthcare Cost Transparency Board. And so these folks are supposed to, based on a law that was passed several years ago, look at, what's really driving the incredible increase in costs. I mean, any of us that, whether you've got private health insurance or you're on a government plan, whatever, for most of us, costs are through the roof. And yet at the same time, you've got all these hospitals, all these private practice providers barely, saying, hey, wait a minute, I'm in the red again this year. So what's going on? So this transparency, this cost transparency board is supposed to gather everybody together, have all of the stakeholders input, and then, basically have some takeaways. So they had this meeting. And the first two folks during public testimony for this hearing were from the Washington State Hospital Association and the Washington State Medical Association. And Shalene Whitaker, who's Vice President of Government Affairs for the Hospital Association, she right out of the gate, she says, hospitals are not doing well. And it's only going to get worse based on what lawmakers did this past legislative session. And that was kind of setting the tone for the way the public comment period went. It was pretty brutal.
Yeah. So it's just interesting that the use of price controls is this idea that, you can't raise your prices over a certain amount is not going to have any effect on the market itself. It's because prices reflect cost of a service or a good.
Yep.
Saying you can't raise it even if the costs go up, right?
Well, exactly. And then these, doctors, hospitals, whatever, large, reimbursement for Medicare, Medicaid, a ton of people covered that way. If they're not getting the same reimbursement rate from the feds, their costs have gone up for everything think about the costs for, heating, ventilating a large hospital, right? Think about just just building costs. Then you've got employee costs, insurance for those employees. I mean, every cost imaginable, the cost of the equipment, the cost of, and tariffs impact on every level. And then you're going to tell them, okay, it might cost you to run that MRI machine for, Mrs. Jones for the next 20 minutes. That might cost you, hospital A, $250, but, you're only going to be able to charge her insurance for that, $170. That's the cap for the 20 minutes of the MRI machine. How does that work?
I think the crazy part was the B&O tax increase on physicians groups of 40% since 2019.
Think about that.
All these cost increases, and yet quality it's much like other sectors of the state, where costs have gone up, but quality is not going up with it. And it seems, what do you see going on in terms of what are they trying to do with the medical industry? Like these price controls, they're looking at why prices are going up, and they're being told because you're meddling in the medical sector, you're trying to engineer an outcome. In this
they're
case,
not listening. That's the problem, because these same folks, TJ, from Washington State Medical Association, Washington State Hospital Association, private providers, I sat in on those hearings during this past legislative session when they were considering a number of bills that, whether it was increases in the B&O tax or significant new regulations or, capping, services, that can be charged. I sat in, these same people testified and basically said, you're killing us. We've got 80% of the hospitals in the state that are already, either barely making, enough to pay the bills, or they're in the negative yet again, year after year after year. It's getting worse. And yet the regulations are piling on. But the majority party in Olympia refused to hear it. They did not listen to reason in those hearings. And so again, I feel like in watching this transparency board hearing, it's those same folks saying the same thing. hey, this ain't going to work. In fact, what you did this session's only going to make it worse for us. And yet you've got this transparency board, many of them appointed by the governor's office, maybe perceiving to have some agenda, that this is going to be our findings as a task force. I don't know.
That's kind of the issue, is that this board is supposed to find what's causing the cost to go up. What if it's the people who appointed them?
Well, and that was kind of anyway. You are spot on. I spoke to Elizabeth New. She runs the Center for Healthcare and Small Business at Washington Policy Center, and she pointed out in her article writing about this meeting. She said, I hope they were listening to the people that testified, because the guy from the Washington State Medical Association, he said, please look at the fact that the very regulations, your well-intended regulations, right? Because you want to keep costs down for, Joe Public that has to go in and, have the MRI, whatever. Well-intended, whatever. But what you're doing is ultimately driving up the cost, because guess what? Like Elizabeth New said, it's like a tube of toothpaste. That's going to come out somewhere. It's going to come out on the other end. If they have to squeeze it here, it's going to come out on the other end. And then you wonder why your premiums go up for your private health insurance plan. Then you wonder why you can't get in to see your doctor.
It reminds me.
I had to make an appointment for a physical therapy appointment for a recent vehicle accident. 2.5 months wait to get in for an initial physical therapy consult. And that's with a referral after an MRI. Because there are only now 2 doctors in the medical system that I, see that even are taking any new patients. The rest are not taking new patients. So that's the real world result of what we're doing.
It kind of reminds me of when the insurance commissioner made it illegal for insurance providers to use credit reports as part of rates. Right. This whole idea was to eliminate disparities in rates for different ethnicities, and the result was everyone's rates went up. Yes. And then they tried to hold a hearing on why all these costs have gone up, and it's interesting how state officials don't seem to understand or care about the fact that when they do something to the industry, there's an outcome. There's a cause and effect going in there, and you can't force you can't force an outcome that goes against what's going on in the market. And that the other issue is that there's also the public. There's like Apple. There's public forms of healthcare in the state. There's like a public option, and so you have the state involved. And it blurs the ability of it makes it difficult to understand what's actually going on, because there's so many different elements. And as you mentioned in the story, there's Medicaid and Medicare. There's other things that are going on that there's a mixture of the public and private sector. So you couldn't call this industry truly private and say that the outcomes are the result of the market itself, because you have other forces trying to generate an outcome here. And it doesn't seem like it doesn't seem like the discussion is around what are ways to cut unnecessary costs for hospitals or medical providers. What are ways to make it easier for them to do business? Because I obviously wasn't alive, and neither were you. But back, just a couple decades ago, the medical industry didn't cost that much, and most people didn't have insurance. Incidentally, it was during World War II when they had wage controls. They froze wages because they also had the food rationing. Everybody had a ration book. And so they made this change with the IRS code that allowed employers to offer health insurance because they couldn't offer higher wages. And this was during the war. And that never changed. And that there is one of the many reasons why privately bought insurance is so much more expensive than getting insurance through your provider, and why having a job is tied to having medical insurance as opposed to car insurance or other types of insurance. You don't need a job to have house insurance, right? You can, and all that kind of stuff. So it's just interesting where the discussion isn't on here's all these government policies, and this is the effect it's having according to the industry, and can we change it or can we get rid of it? Instead, it's saying what more can the state do to make things better? And the industry seems to be saying, stop.
Well, that's it. And if in fact this healthcare cost transparency board is really about being transparent, and their goal truly is to, come up with some solutions or at least recommendations that they can bring to lawmakers and say, yeah, as it turns out, we're hearing that, what we did 2 years ago, 4 years ago has created this. And the concern now is what you did this past session is going to make it exponentially worse, 2 years from now. Maybe we better rein that in a little bit. I mean, let's hope that that's really going to be what the ultimate takeaway is, and that they're not going in with an agenda truly. But when you have many of these folks, as you mentioned, appointed by the governor's office, and these folks, represent folks from the office of the insurance commissioner and the state health benefit exchange, which is, the one that we as taxpayers subsidize all these folks so that they can have state health insurance. If you're really going to have folks coming on a transparency board and you want solutions, we're going to have to look at the makeup of the board, I should say. And let's give them the benefit of the doubt between now and when their next report to the lawmakers is due, that they'll actually have some solutions. And maybe somebody in Olympia will listen. I don't know. You'll see.
Keep an eye on that and see if they do an about face or change of rhetoric. So
yeah, my pocketbook could use it.
Thanks, Darlene. Listeners can keep up with this and other stories at thecentersquare.com. I'm your host, TJ Martinell, and thanks for listening.